it is Ruth from Becoming Mrs. Button Queen. I think I was wearing this last time, but anyway, it's been almost a week since my last video, so today is June 29th. I just want to talk about blood tests. So I had to have my bloods done, so for my surgeon. I go back and see him next week, and I was in there for 45 minutes. I had two lovely ladies trying to get blood, so they both tried my left arm, my right arm, and the next one came in, my left arm and right arm. Finally, they got it out the back of my hand there. And that was really slow, and the surgeon had requested maybe 6 or 7 tubes, and so I know I don't have good veins, and especially when I'm having a fasting blood test. So I had drunk 1.5 liters of water since last night to make sure, and I drank nearly a liter on just a liter this morning. I had kept my arms warm to try and keep my veins up, and there just wasn't any blood or veins around. And I want to know if anybody has had similar things, if after the weight loss that has improved. Drop it in the comments below if you've experienced an improvement or it's got worse. I hope it doesn't. I know that losing weight is not a magic pill to fix everything. And my goal is to make my life better after this procedure, and it'd be a really cool NSV if it was easier to have blood tests after surgery, considering that I'm getting the gastric bypass, so I'll need to make sure that I am watching my vitamin levels. So I'm from Australia, and we have a few Australian Facebook groups that I'm a part of, and I'm also part of Lisa from Mini Me in Tennessee's group, and Australians are very relaxed about things. So one lady asked today, how often do you get your bloods checked? And one lady said 6 years post-op, never got them checked once. And I'm thinking, you probably should, So I already have a tendency to have anemia and to not carry iron in my body well. So I know that I want to be watching that for sure. So yeah, today was a weird day. So I went to go to my blood test place. I pulled up to my normal place and looked at the time. It said 7:30 openings. That's great. And read this sign in tiny, tiny writing that said, because of COVID, it is closed. So then I went to my next favorite place, and they were completely shut. Their business sign is gone. They're not there at all. And then I went to my third choice, and it was really busy. We had 6 chairs inside the waiting room, and you had to wait outside if they were full, and they were all full by the time I got there, because I got there so late because I was waiting for this other place to open. And then I had to wait outside. It was freezing, so I was very happy to go inside in the warmth. And then I had maybe 10-15 minute wait, and then 30 to 40 minutes while I'm praying. I prayed so much that they'd be able to get the blood out, and eventually they did. So yeah, I haven't got too many bruises. I am allergic to the little tape that they stick on you, the medical tape. It makes me itchy after a while, so I take it off pretty quickly, which someone once told me is why I bruise, but I think I just bruise like a peach. Like a peach. No update really as far as anything else goes. I've started using an app called Baratastic, and the reason I did that, I always use my Fitness Pal, but I want to track my macro. So Baratastic is a free app, and all of that stuff is free. So it has a really cool dashboard on it. That's really, really easy to use. It doesn't seem to have as many foods in it. I'm spending a bit of time taking pictures and adding in manual things, and then they upload them to the system. So maybe it's a new app. I can't even remember where I found it. I just remember seeing it and deciding to try it, and it's really, really good. I'm really, really happy with it, and I'll keep using it right up to surgery. So it has a cool countdown tracker, and so if the date is somewhere around where I think it's going to be, there's 84 days till my surgery, which is a long time. So but not long. Long but not long. So I'm not nervous about that. I'll go in next week. We'll make the surgery booking. I will pay the deposit and also arrange time off from my work. I really don't want to tell anyone at work that I'm having this surgery, says the woman putting it on YouTube, right? I don't know. I want to tell people when I'm ready. So we'll see how long that lasts. I guess maybe because lots of people have seen me try and fail, and I've done all kinds of weird and wonderful diets. Maybe because other staff members have recently had surgery, or a little while ago had surgery and put the weight back on, and there's a lot of opinions. People have a lot of opinions about it. So it'll be interesting to see. I just know I can't keep going on the way that I'm going with my weight, and I can't exercise, and then I get in pain, and then I get depressed, and then I eat junk because I'm in pain and sad, and I don't like that. So I saw a post about a lady who had been told probably similar to what I had. She has fibromyalgia as well and arthritis, and I don't have arthritis anymore. I had it growing up, and they say that there's no evidence of rheumatoid arthritis, but I have cartilage damage and the neck of a 90-year-old apparently. She said that she was really upset because the surgeon said she's not going to reach a weight that's within the healthy BMI weight range, which is also what happened to me. And a lot of people said, you know, especially if you have conditions like that, they're going to under promise because they don't want to get your hopes up and let anybody down. And so I'm hoping, well, no, I'm not hoping, I will be one of those people that gets down to their goal weight and settles in a healthy BMI. I will be. I just have to be. And so this channel is going to help me do that and help me remember why I started. And I want to weigh less than my husband. It would be the first time ever in my life I've weighed less than my husband. So I want my surgery in September, in the school holidays, so that I can avoid telling as many people as possible. And then it will be nearly 10 weeks roughly till I go away with my husband to a race on the other side of Australia. And I will be 10 weeks post-op, so I'm hoping maybe I'll be less than him by race day. So in the doctor that referred me, I was 109. The surgeon, I was 106. So I haven't weighed myself again. I'll wait till I go in next week to see him and see what my weight is there. And then I'll come home straight away and weigh myself here so I can get an idea of what the difference in the scales are. I see the dietitian on Wednesday. I've got a lot of questions. My biggest fear is that I will lose so much weight before the surgery that they'll refuse to do it, which is a stupid fear because it's win-win either way. But I know myself, and I know I need this tool to help me. So I will white knuckle it through when I have to, but I need this tool to change my physiology and the way that I look at food and the way that I crave food and my hunger and stuff. So yeah, that's my biggest fear right now. Stupid, but there it is. Anyway, that's me. 10 minutes, nearly up. See you next time.